Hi, my name is Jackie Evans, and this is my truth and my honest, soulful position of what I've seen the past year and a spilling of my emotion and thought behind what I've seen, what I've endured, what I've been part of, and now what I have ended as my 30-year career as a respiratory therapist, one who helps, one who does my best to heal, to give good, bright, vibrant energy towards those who are sick and ailing, and to those around me in the workplace for all these years. I chose to end my career completely and finally about a month ago. The first wave of the virus was difficult for me, and some of the things that I saw during that time were disturbing and were a change in the whole attitude of healthcare and caregiving as I'd known it for so long. I'm not going to go into those things today. It would be an endless video, in my opinion. Today, what I want to concentrate on is what I experienced the past 3 months before I quit a month ago, that brought me to the realization that a lot of the treatment for this virus to me felt like end-of-life human torture. That may sound extreme. It may sound very dark and very sinister and very unlike anything that anyone has probably ever heard come out of my mouth. But it's time that I get this part of my story out to help to cleanse and heal my own soul. So, the thing that really brought me to the point where I'm at, and I'm going to preface it with this. This is my personal opinion. This is not anything that I am putting out there to say I'm right, or that what I'm speaking is truth to or for anybody else. But it is my own truth that I have experienced and now want to put out there, for I do not think most people know or realize what is going on a regular basis. The treatments for this vary from medications to therapies. As a respiratory therapist, I was involved in both breathing medications, delivery of them. I was in charge of running the ventilators that supported their breathing while this attack on their lungs was taking place. I was also part of a team that, while I worked in the specialized virus ICU, I was part of the team that was involved in what I am now considering a form of end-of-life torture, is the therapy and protocol of proning a patient. I hadn't even really heard of this my whole career until maybe about 10 years or so ago. Whenever patients with very stiff lungs, we would prone them. When I was in Pittsburgh, we would do it with a very specialized bed that you may have seen these type of beds for neck trauma, head trauma patients, where the bed is rounded and it actually rotates through a machine, and you can, it's very padded and weighted in certain places to help decrease any trauma to the skin and other things like that. They quit using these beds at the one hospital I was at because they were so expensive to rent them. And then it kind of, that whole therapy seemed to have, they weren't using it as much. They were doing other things through the ventilator to help to expand the lungs and help oxygenate the lungs better. Whenever the virus hit, they began to use the proning, it's P-R-O-N-I-N-G, therapy more often, because it does have an effect when you physiologically shift your anatomy, the pressure in your lungs shifts, and it does help to increase oxygenation. I'm not saying that the therapy does not work. What I'm saying is the protocol that has been used in the treatment of this works in some cases to a certain point. Most cases that I personally have seen is being used at a point in the viral process that there is very little or no chance of return to life, to normal life, to any life, let alone to life at all. The proning protocol was to turn the patient flat onto their belly on a regular bed for 16 hours at a time, and then turn them back over to their back, which is supine, for 8 hours. And as tolerated, they would continue this process in hopes of an increased oxygenation and improved lung function, because they were to the point where the ventilator was not even able to give them adequate oxygen in their blood to supply to their body. I understand the philosophy of it. I understand that it worked to a certain point. My point is, the one day I came in, and we would have to have a team of maybe 5 or 6 of us, maybe 7, sometimes 8 of us. We would be doing this to several patients in this viral ICU on a certain shift. Several of them would be doing this rotation. So we would have to have a team of us to actually to do this, because the thing is, and this is where part of my issue lied, was to be able to do this process, the patient has to be paralyzed and sedated. The patient has to be paralyzed completely and sedated. Because can you imagine being sick in bed on a ventilator and flat on your stomach for 16 hours straight, unable to move, unable to voice anything during that time, not being able to say no, not being able to say, this is painful, as the blood rushes to the whole front side of their body and their faces swell and their lips puff out so completely, because it's not natural. The one day when I had the realization was, every time we go to do this to a patient, we would go to flip them, and it's a process because they're paralyzed. It's dead weight. Most of these patients have a comorbidity of obesity, most of the time due to diabetes. So they're larger patients also. every time we would go to do this process, because of all the lines, all the medications, the IVs, the ventilator, the breathing tube, it's a very touchy process. You have to be super careful. So each time we would do it, every single time, it would never go smoothly. I'd be at the head of the bed, supporting the head, watching the airway, helping to turn. Every time we would turn, you never know which way the head was positioned right. The tube would feel like it was always going to be kinked. And I actually spoke out loud. I said, this never goes right or smoothly because we are not supposed to be doing this in this manner. And, working in healthcare, sometimes you just go with the flow. You have to you can't hold everything in, you see. You can't take that all in. And at that moment, it just blurted out of my mouth. We are not supposed to be doing this. And then a lot of times, you flip them back over and you see the shape their body is in. And I realize for some patients, it works. Me personally, the 3 months that I was there in that intensive care, I don't think I saw one that came off the ventilator that went through these processes. This has been very hard on me. When I realized I was part of it. I was part of the end-of-life torture of a person, of a soul who couldn't scream out, whose families were rarely or not allowed to visit, to advocate for them. This is my story. This is my burden. I am hoping me releasing it, my opinion, just my little opinion, that it might help somebody somewhere. Maybe somebody whose family member might be in that position. And when their doctor starts talking about that, it might be the last ditch effort. But the only thing I've seen is it's only extended life for maybe a few more days, maybe a week. And I can't be a part of it anymore. I quit. I walked off the job. I walked out. I thank each and every one of you for listening to me, for watching this, and please share this out if you feel led to. I don't think too many people are telling this side of this story. And I'm not afraid. I give my name. If things happen, things get taken down, things get deleted, I get a knock at the door, I get a lawsuit, whatever, I don't care. I don't care. Because if I was paralyzed in a bed, forced to lay on my belly for 16 hours without moving, being able to twitch a muscle, being sedated, and not really having much of a gauge of anyone else other than blood pressure or heart rate, how sedated you really are, it's worth it. This is Jackie Evans. Jackie Fox, 333. Have a great, blessed, light-filled day. I love you all so much.